It is one of the most common chronic pain conditions.
Fibromyalgia affects an estimated, this is crazy, 10 million people in the United States. Dr. Matthew Christensen is going to talk to us about how chiropractic can actually help with those of the people that suffer from fibromyalgia. Great to have you here, man.
Yeah, it's an honor. Thank you, guys.
So let's start with maybe just what is fibromyalgia?
Well, Chris, if you break down any medical condition to its Latin roots, it becomes discernible very quick. So fibro meaning fiber, myo meaning muscle, and algia meaning pain. So at its core, it's muscle fiber pain, but honestly, it's quite more complex than the name implies.
So give me an example. What do you mean? Like, would it be in my elbow? Could it be anywhere in my body?
Yeah, the pain is rather systemic, and it can vary day to day. They can have pain in their shin, they can have it in their low back, they can have it in their shoulder. It can vary tremendously, and the thing is each patient experiences it in a different manner.
Is this something that you see here in the area too? You have a lot of patients with it who are
Oh
suffering?
yes ma'am. Yeah, we see quite a few folks who've had it, and typically when they come to a chiropractor, they've had it for, they've been to multiple doctors and they've had it for many years.
So talk about how maybe even your journey to chiropractic, being a chiropractor, and then
Yes,
how
sir.
does it impact fibromyalgia?
Well, typically what we see with fibromyalgia, or what leads to it, is if you look it up in the medical dictionary or any kind of medical source, it will say unknown etiology, which basically means we don't know. But typically what we do know is that there's a predisposition, a genetic predisposition, like any illness, coupled with either a severe emotional or physical trauma, and at that point the nerves become overactive. Now in our office what we see is folks that come in, they've usually had a trauma to the head, neck, or upper back, which leaves nerve damage in those areas, which soon thereafter they start to suffer these symptoms.
So other than coming to you, are there other treatments that they're usually trying before they come to a chiropractor?
Oh, certainly. Like I said, we're usually not the first person they go to. Most of them have been diagnosed by their medical doctor, and most of them are on medications or have had massage or other things, and yes, ma'am.
So how will I know, because I always thought my fibromyalgia was like, okay, I've got this sort of constant pain in one area, but you mentioned before it can be all over. So how do I know if what I'm feeling is actually fibromyalgia, or is it just a spasm, or how do I know?
Yeah, well, the thing with fibromyalgia, it's more a syndrome, which is a collection of signs and symptoms that can vary tremendously, again, per patient. So what we see is that there's an imbalance in the nervous system and the endocrine system. Their nerves are hyperactive, and I always tell my patients it's as if their pain volume is all the way to max. And along with that, not only do they have this hypersensitivity of their pain, but essentially there's trigger points like you're seeing behind us here. There's usually 18 of them, and these folks, the problem is some people come in, they have 3 of them, they have 5 of them, some can have all 18. Again, it's rather elusive in nature.
Wow, I'm sure that must be uncomfortable for them to live with day in and day out too.
Yes, of course, and here's a reality, guys. Most people that have fibromyalgia have suffered for years before they get a formal diagnosis. So I think you would agree with me, constant, almost daily debilitating pain, yet every test they do turns out normal. And again, very frustrating.
Wow.
And thus the reason to go see someone like you, and then you start working on my vertebrae and my muscles, or what?
Yeah, well, again, like I said, if they've had a trauma, the people that we can typically help have had a physical trauma to their head, neck, or upper back. In those areas of nerve inflammation or irritation, essentially those nerve impulses are distorted. And our goal as chiropractors is to find where in the nervous system and skeletal system that damage has occurred. And when we address that, our goal is just to turn that pain volume down, which has been the answer for many.
Wow.
That's awesome, man, if you're doing that. All right, stick around. We're going to have more about this right after this short break.